for joining. Welcome to our NephCure U with Dr. Blair. We are going to be talking today, Dr. Blair is going to be talking today all about his role and what he's been focusing on and working on in the as the Director of Government Relations and Advocacy. Dr. Blair comes to us. Let me get my... Prior to joining NephCure, Dr. Blair came to us. He has had many roles working in health policy on Capitol Hill and has worked as a biomedical researcher also. Blair worked as a professional staff member of the select subcommittee on the coronavirus crisis, which I find so interesting. He led a corporate investigation regarding insider trading and financial improprieties, conflicts of interest associated with the leadership of Operation Warp Speed, and the politicization of scientific information. Blair has also worked for Senator Brown from Ohio and has helped crafted other bipartisan acts for other advocacy organizations. They have also spent their time as a medical research scientist on several industry and NIH-funded projects focused on developing research and clinical trials to improve the lives of African Americans with sickle cell disease. Blair earned a Bachelor of Science from the University of Kentucky and a PhD in biomedical science from the Morehouse School of Medicine in 2017. Blair, thank you so much for being here today. I know that prior to you coming and working with NephCure, which we are so blessed to have you here, the new era bill that you're going to be really going into today for our audience started back in 2020 before you came to join us. But this bill is really a accumulation of work that started back in 2020 with the rare kidney revolution, where we had input from patients, healthcare providers, industry, diversity health organizations, and more, where we as a collective really developed a set of high-level recommendations for a call to action around rare kidney disease. And so, Blair, thanks for being here. I want to give you the floor. You can share your screen. We want you to be able to dive deeper into this. I know that you gave a version of this talk at our annual patient summit, and I am just thrilled that you are able to dive in a little bit deeper today with our audience and give us a good overview of what you've been working on and some of the focus that you have. So with that, I'm going to turn it over to you.
Thank you so much, Nurse Kristen. I so do appreciate the large introduction that makes me sound much cooler than I actually am for those who have met me in person. But I'm so excited to see everybody again. We have such a large attended group here watching us at home, and I miss seeing everyone's faces like we were able to see at Patient Summit. But there's an opportunity coming up for everybody to see each other's faces again virtually, but it's still everybody's faces. So let's hop into this wonderful presentation. If you saw my presentation at Patient Summit, this is a little bit more of a deep dive on this than you got at Patient Summit. And we have an opportunity here in the chat box to ask questions. Feel free to interrupt me at any point in time. Do not wait until the end to where your question might not have the same sting or the same excitement as it would in the moment. So let's make this a conversation as much as we can over Zoom. So hi everybody, as Kristen said, please call me Blair, Dr. Blair. Seems to be the nickname that has come out of Patient Summit, and I will begrudgingly and happily accept that. We're going to talk about our NephCure Action Network especially, and we want to talk about that new era of kidney care that I was able to share with everybody, and everybody I think got some excitement over seeing at Patient Summit. And I'm trying to, there we go. We talked about it a little bit at Patient Summit, but I do want to hit on it again because even more craziness has happened since we last met at the end of April, and that is NephCure and NephCure advocates and the folks that make up our organization, and not only the folks that make up NephCure. Exciting stuff. We've been able to actually outreach about the new era bill and NephCure advocacy with several partner organizations. I'd love to give a shout out to our friends and folks at the Outport Syndrome Society and Miss Lisa Bonebreak, who have been incredible in helping NephCure advocates also advance our legislation and help advance this new era for rare kidney disease care and treatment. For those of you who were not at Patient Summit, let me give you a little bit of a background. Over the past few years, NephCure has been working hard, not only getting patients and patient families and rare kidney disease advocates up to the Hill to talk to their Congress folks, like you see in these pictures. Some of these folks you may know, and some of them have grown a lot since these pictures were taken. But in a combination between NephCure patients, NephCure staff, and our fine industry partners and our society partners like the Alport Syndrome Society, like the American Association of Kidney Patients, like Travere Pharmaceuticals, we have been able to put together and sort of look at the landscape and see, what do rare kidney disease patients, what do rare kidney disease researchers, and what do corporations or nonprofits who are interested in advancing the cause of rare kidney disease, what do they need to move the ball forward to save lives, save kidneys, and prevent dialysis? And all that work, all that hard, really hard nose grinding work came into fruition this past March when we were able to introduce HR 7506. And HR 7506 is the New Era for Preventing End-Stage Kidney Disease Act. It's a mouthful, but it's a big, exciting piece of legislation. Again, thanking our corporate and our nonprofit partners who were able to help us push this forward and get this to where we needed it to be. It was introduced in the House of Representatives, and we're going to talk a little bit about sort of going back to that Schoolhouse Rock and seeing where the bill is at on the big picture in a few moments. But it was introduced in March, and it was a co-sponsorship between Gus Bilirakis, who is the Republican who serves the Florida's 12th congressional district, which is around the Tampa area, and Congressman G.K. Butterfield from North Carolina were our two co-sponsors on this bill. The legislation really breaks down into about 5 very broad buckets. We will put in the chat box at the end of today's presentation a link to where you can get the actual bill text that looks like what you see here on the left. That's very important. They're fancy and from the government printing office. It'll also have a nice 1-page summary that'll just quickly in a page summarize what's in the bill and why it's important to you. We have a section by section, which will sort of do what I'm about to do here and walk you through piece by piece, helping to understand a little bit deeper about the bill. And if you're super wonky and you love your Washington Post and your Wall Street Journal, you have the opportunity to look at the funding breakdown, which understanding the money that would be given to things that are listed in the legislation. How much is it over how many fiscal years, et cetera, et cetera. So we'll walk through these real quickly. And again, if this is too fast, if you want me to focus a little bit more, if you want me to go deeper on something, please write in the chat box and we'll make it happen. You'll have to excuse me. Our first box over here that's highlighted in red is we are going to establish centers on rare kidney disease research at the National Institutes of Health. For those that don't know, and for those that do know, here's a refresher. The National Institutes of Health, or the NIH, is the United States government's sort of premier research, healthcare, the melding of research and healthcare into that sort of bench. We called it, when I was a researcher doing clinical trials, we called it bench, as in the lab bench to bedside medicine. How do we take something from an idea to a research idea to some experiments to a clinical trial to where you're receiving it and picking up at your CVS or getting it infused at your local nephrologist? And at the NIH, we want to establish centers on rare kidney disease research. And this sort of breaks down into 3 buckets. We want to develop resources for clinical researchers, provider training, and by provider training, I mean your nephrologist, your general care provider, etc. Diagnosis, prevention, and the treatment of rare kidney disease. And for that would be $4 million over the next 5 fiscal years. So it'd be $4 million one year, $4 million the second year, et cetera, et cetera. We also want to direct the NIH to conduct a signature genotype-phenotype study to inform rare disease diagnosis. If you were at Patient Summit or were able to watch Patient Summit online, please know also that the videos for most of our presentations from Patient Summit are on the NephCure YouTube page. And we can link to that in the chat box as well, so you can catch up on all the goodies that you missed if you weren't there. It was a great time, and we hope to see everybody again next year when we have it in San Diego. We directing the NIH to conduct this genotype-phenotype research as a very sciencey, dry sciencey term, for we want to understand how genetics and how not only the genetics that you're born with, but the genetic changes that occur just from being a living, breathing human on this green earth, how those might affect rare kidney disease, increase the diagnosis of rare kidney disease, or change the outcome of your rare kidney disease, the prognosis of your disease. And so that's 1 million per year per each fiscal year over 5 years. And just to note that this funding for this specifically will be available to public and private nonprofit entities. So moving on to that second bucket, we want to promote and create new diagnostic testing protocols. And this really comes from us listening to patients and patient families and understanding and sort of really cueing in on this topic that comes up every time I talk to a new family. And that's this diagnostic odyssey from when you or your loved one or your child first starts experiencing symptoms. How many nephrologists do you have to walk to? How many tests do you have to do? How many general practitioners are you going to have to see from the first time you show symptoms, or you pop weird on a GFR, or you have protein spilling in your urine? How long does it take from that event to when you're getting quality, informed, expert level healthcare from a provider who knows how to treat rare kidney disease? What's the length of time to that? And we find that more often than not, it's too long. And taking too long, as all of us know, leads to unhealthy kidneys, the possibility of dialysis, and eventually possibly a transplant. And those are things we're looking to avoid. And so we want to direct the Department of Health and Human Services, which is the federal government branch that oversees the National Institutes of Health, who oversees the NIH, to convene a conference on diagnostic methods for rare kidney disease to address the existing barriers and accelerate the diagnosis of rare kidney disease. We want to understand what's making that diagnostic odyssey, such a trip, such an adventure, a very bad adventure, and what's not making it, instead of a diagnostic odyssey, more of a diagnostic trip across the hallway. We also want to direct that Department of Health and Human Services to conduct a study on early intervention of genetic screening and whether it can improve rare kidney disease health outcomes. Basically meaning, we see a lot of companies that NephCure works with, and a lot of biotech companies and industry, and even some academic partners who have genetic tests that are looking for, genetic markers of rare kidney disease. How early do we have to give folks these tests, at-risk individuals these tests, to where once we give them this test, how early can it pick up the rare kidney disease? And if it picks up the rare kidney disease early, or maybe some sort of signs that say you could have, this is me spitballing, a pre-rare kidney disease, or where things are looking like they could go a bad way. If we get there early enough with the proper healthcare and proper medication and lifestyle guidance, is it going to make a difference in saving kidneys and saving lives? And so that's what we're asking the Department of Health and Human Services to examine here. And the best part about this is we're requiring the NIH and the Department of Health and Human Services to consult with stakeholders like NephCure, like the Outport Syndrome Society, like the American Association of Kidney Patients, to talk with those folks, to talk to the individuals with lived experience, put together a report, and get that report to the Congress within 18 months of this bill being enacted. That means within 2 years, we have actionable, valuable, well-collected, well-researched information that we can use to inform healthcare decisions, to inform the development of new treatments and new diagnostic tools to, again, save kidneys and save lives. And that's $5 million, which is not a lot of money in the scheme of what the federal government spends, but that's $5 million each year for 5 fiscal years that can change lives. Into this next bucket. We have this next bucket is something that's especially near and dear to my heart, and I think near and dear to a lot of the NephCure community and staff's heart, is we want to really address disparities in communities of colors. And to me, this speaks to me such importantly, especially in the month of June. For those who had the opportunity to meet me at Patient Summit or listen to me speak, I'm a trans woman. I'm a member of the LGBT community. It's June, it's Pride Month, and it's a time, I think, for all of us to reflect, not only within my LGBT community, but as a society of a whole, how we have left communities behind. We have left individuals behind in the healthcare system purely because of the way they look or who they love or their gender identity. And this is a way to really address what I think is a glaring systemic issue in the healthcare field. And we want to get outreach, and we want to figure out how we can help our communities of color. Communities of color make up anywhere from 10 to 15%, depending on the census or who's talking, of the American population. But they represent 25 to 35% on any given day of our patients on dialysis. And to me, that screams a small group of people in this country, relatively, are being disproportionately affected by rare kidney disease, or kidney disease in general. But not only are they being affected by it at higher rates, they're not getting to a nephrologist. Their diagnostic odyssey never is ending, and they're ending in that never-ending diagnostic odyssey has put them on dialysis and the road to a transplant. And for our families here in the chat room, and for our folks here at NephCure, we know that that is not a road that is fun to go down, and we want to avoid it at all costs. And this is NephCure's and our partners' real stab at trying to address this issue. We want to create a communities of color service program for nephrology fellowships that go to underserved areas. Not only is it just getting trained nephrologists into these communities of color, but it's about getting nephrologists that look like the communities, that have the same lived experience of these communities, because the research shows that when your doctor looks like you and your doctor has lived the life you do, you are more likely to take their advice, you are more likely to be compliant on your medicine, and you're more likely to stay on top of your health. These things are undisputed in the research and in the literature. So we want to actualize that research and literature into something that, again, is going to save kidneys and save lives. We also want to direct the NIH, again, to report on diversity in research programs. And that's just not about, are we giving money to research in communities of color? We want to know, are the researchers, do the researchers have the same shared background and socioeconomic and racial background as the folks that the research is serving? Are the clinical trials that are being funded by NIH money, are they reaching out to communities of color? And this report will help us get to the bottom of that. We want to make sure that the federal government empowers our community-based organizations to provide patient education referral programs for nonprofits, local agencies, communities of faith, places that individuals of color are already interacting with, that have already built a level of institutional trust with, so that, it is, I'm at church, and the fine folks from several of our nonprofit partners. There's a wonderful community organization in Atlanta that is at my church today, and they're going to, you got to use the bathroom anyway after church. Here's a cup. If you want to, do it. If you don't. And we'll get back to you next Sunday. And then if something's wrong with your urine, it's free. We'll figure out where you need to go. We'll refer you to a service. We'll walk you through what it needs to figure out what's going on in your body. And that's what we want to do with this piece of the legislation. We also want to conduct a study on social, behavioral, and biological factors, things that you don't talk about beyond your doctor's visit. Or do you smoke? Are you overweight? Do you eat a plant-based diet? We want to look like, what is your job? Where do you go? What do you do? What's different about your life and your family's life, and the lifestyles the varied lifestyles of people of communities of color? What is about the living this that is exacerbating or really making sure rare kidney disease shows up more than it does on average in the general United States population? And again, attacking that diagnostic odyssey. This legislation aims to promote provider education and access to specialty care. And this is establishing a grant program for hospitals, medical schools, academic training programs, public entities, nonprofits, everything else under the sun. How can we develop a nephrology training program for primary care providers? How can we get your primary care provider, or the person you see at the urgent care, or the doctor you see once every 2 years when your husband and wife or your partner harasses you to go get your checkup? How can we train those physicians in the limited time they see with you to look at your test results, know that something might not be right, know that something kidney-wise isn't correct, not only to recognize that, to learn how to recognize that, but learn how to refer you, to learn how to guide you through, okay, let's get you to a NephCure endorsed specialist. Let's see what NephCure has. Let's see what the Alport Syndrome Society has in terms of literature. I know enough about this to be able to talk to my, when your physician knows enough to talk to their colleagues to see how best to serve you. So just, again, doing what we can to decrease that diagnostic odyssey. And we want to also establish a grant program for public and nonprofit entities to provide, continuing education and training, again, to healthcare providers. And that last bucket of stuff, which is a little bit more wonky and a little bit more in depth, and if you don't understand it all the way, that's perfectly fine. Most of the people that work in Congress wouldn't understand this either. We want to expand rare kidney disease research, and two things. We got a lot of drugs in the pipeline coming up from pharmaceutical organizations that are going to hopefully, knock on all the wood on the world, have the ability to change the lives or at least improve the lives of rare kidney disease patients. And we want to make sure that when the people at Medicare, the people who decide whether your Medicare or your Medicaid program is going to cover this new drug, we want to make sure that the panel that makes that decision includes 2 independent experts with expertise in our field so that the right decisions are made and the new drugs that are going to hopefully change your or your family or your child's life, gets into your all's hands at an affordable price. And we also want to direct the secretary, the guy who runs, or the guy and gal, whoever it may be, who runs the Secretary of HHS, Health and Human Services. We want them to really sit down and figure out, how can we change or improve the way that we treat rare kidney disease so that we can focus on ways of improving care to decrease the need for dialysis and transplant, while also outreaching and improving awareness of rare kidney diseases in communities of color. So those are our 5 buckets. It's a lot there. It's a lot to take in and a lot to learn. Again, my cell phone number, my email, everything you need from me will be in the chat box once I stop yammering. Feel free to reach out. Let's set up a time to talk. Call me, text me. I want everyone here to be educated about what we are doing as an organization. So the question is, what's next for the New Era Act? Excuse my large, poorly drawn map. But we are right here where that big orange arrow is. Our bill has been referred to the House Committee and has been referred to the House Committee on Energy and Commerce. Right now, we are waiting on the Energy and Commerce Committee to take up consideration of our legislation. This is going to take some time. Things move very slow in DC, as you probably are very, very aware. We are also trying to introduce our bill, get someone to introduce our bill into the Senate. It is important that the bill be introduced in both houses of Congress so it be considered separately by both houses of Congress. And I'm hoping, knock on wood, by the time Rare Kidney Disease Week comes up in July, that 3rd week in July, and our Hill Day comes up on the 19th, we will have a Senate sponsor, and we will be able to go to the Hill and thank our Senate sponsors. Rare Kidney Disease Week, it's so exciting. Folks, I have been blown away by the amount of registrants we've had for Rare Kidney Disease Week. And before I talk about the registrant numbers, I do want to just give a little quick summary of Rare Kidney Disease Week. It is going to be completely virtual this year for a number of reasons. Hopefully we can all be in person next year. It is my hope and goal that that is the case. But Rare Kidney Disease Week is going to be the Rare Kidney Disease Communities Week. It's going to be their time, apart from Rare Disease Month in February, apart from Kidney Month in March, a time when our needs, our interests, our patients can be highlighted, can be shown to the world and said, we are here. This disease is hurting us. These diseases are killing us, and we will not stand idly by anymore and be pushed to the side and told to be happy with what we have. We are here, we are fighting, and we are not going to leave the Hill, or our presence is not going to leave the Hill. We will make as many visits as we need to until we get this legislation passed. And once we get the legislation passed, we'll be back again, because that legislation, that HR 7506, the New Era bill, is going to give us so much information to inform where do we go as a community next? Where does our government go next? And so we're going to have our Rare Kidneys on the Hill, which is going to be our Hill Day, and that's going to take place on the 19th. That's a Tuesday. We're going to have a training the day before. For those who are registered before the training, I am going to send you out a website which will allow you to fill out a survey. That survey is just going to be me collecting a little bit more information about you, about your families, about your interaction with rare kidney disease and your story. And this will help me to help you really modify or improve or really unlock the potential that each and every one of you have on how you tell your story, how you communicate that with members of Congress and their staff, so that we can take some power back for yourselves so you can feel good, feel like you're making a difference, and we can make a difference. That week, we're also going to have a new era in rare kidney care congressional briefing, where it's going to be us talking about this bill to members of Congress and their staff in the larger DC policy community. Talk about our bill, talk about our patients, talk about what we need them to hear and where we need to go. We'll have a congressional resolution honoring the week, and we'll have some advocacy awards. It's going to be a great week. I would ask that you go to this link, use the QR code to register for it. When we left, we put this link up at Patient Summit. And by the time I left the stage at Patient Summit, we had 30 registrants. And I was very, very excited about that. And I said, and I talked to our wonderful staff members here, Nurse Kristen and Kelly Helm. And I said, Kelly, Kristen, if I can have 50 people registered for this by July, I'll be happy. And I think we've made a good start for our first virtual Rare Kidney Disease Week. Well, it's about almost 2 months later, a little over a month and a half later. It's 12:30 p.m. on Tuesday, June 7th, and we have almost 125 people registered. I am blown away by the response from the community. You all have made my day, week, month, and year by this, and I really think we are going to kick the doors down virtually in July, and I think that there's nothing stopping us from having 150 people here next year in person and making this the premier rare kidney disease event on the Hill. Here we go. I've talked enough. I want your questions. Let's talk. Let me inform how I best can. If you're not comfortable using the chat box, this is my contact information. Again, I'm Dr. Blair Kiser. My email is Z as in zebra, KISER at NephCure.org. There's my cell phone number. There's my location in Maryland. I do want to put this up for everybody. If you are in the Maryland area or in the DC area on vacation, or you're going to be here, or you get the itch outside of Rare Kidney Disease Week and you want to talk to your congressperson or you want to talk to your senator, hit me up. I'll make the appointment for you. I'll go with you if you need me to go with you and sit in the room with you, and we'll make it a positive experience for you and your family, and do what we can to empower you. So again, thank you all so much for the opportunity not only to speak here, but the opportunity to serve you and your families. And it has been the honor of my short 32 years on this earth, and anything I can do to help your day be better any day, please let me know. So thank you very much.
Thanks, Blair. Thanks so much. We have a pretty intimate group with us today, and I notice some of the names in our audience today, and I honestly, you can write in any questions or comments, but if you also want to raise your hand, there should be, I think there's a raise your hand button down in the bottom of your Zoom toolbar. If you would like to ask a question or comment on anything, we have plenty of time to just have a conversation around what Dr. Blair has provided us with information today. I think, though, to get us started, and maybe it will prompt maybe some other people to ask questions or want to talk. I'm curious, so when you talked about that first pillar, you mentioned this a Center for Rare Kidney Disease Research through the NIH. And I'm wondering, is that like a physical place? Is that in the mindset of what that looks like? I'm curious, like we all kind of understand like a pillar of, research and clinical care in the oncology world, especially in pediatrics, is like St. Jude's. Is it something like that? I'm curious if you could give us maybe some information. What does this look like?
It is not going to be like they are going to build us a new building, as much as I think that would be great. Yeah. It is more of a collection of institutions, a collection of researchers, and a collection of sort of research infrastructure in terms of, buildings across the country, lab technicians, primary investigators.
Yeah.
It's sort of a center in term. Yeah, it's like NephCure is
So it's like, so
it's an organization in a way.
it's like, it would be like a network
Yes.
of multiple places throughout the country that would be dedicating specific funds from the NIH, I'm assuming,
Yes.
to do research on our rare kidney disease kind of community,
Yes, ma'am.
from bench
To
to
bedside.
bedside.
Yes.
Got it. Got it. I know another piece that I am really excited about. Well, I think all of it is really exciting, but another piece that I think is definitely needs funding and help. And I love that NephCure has incorporated this idea of a conference or some type of workshop work around to really address the diagnostic barriers. You know, looking at the audience and seeing their names, I don't think there's one person in our audience today that doesn't have their own story about either their diagnostic journey or their loved ones. And I think that that's a really big piece, because so many times when we hear patient journey stories, it's about all of the missed opportunities that ended up prolonging them actually getting their final diagnosis. And it's interesting to me. And so I don't know if anyone in the audience has anything they'd like to add or say about that, but I think it is an interesting concept that needs to be addressed. I also think that the genetic component that you talked about in the bill plays a factor in that diagnostic journey. I know that you know, one of our friends of NephCure, you know, had genetic testing 10 years ago when their child was first diagnosed. And I think there was like, I don't know, 10 or 20 maybe genetic markers that were known to contribute to the diseases that we help and support here at NephCure. And now there are well over 100. And so I think that that definitely plays a factor in the diagnostic journey and how they get access to drugs and medicines. So I think that there's a lot to this bill that you unpacked today. I think you went into a lot more detail of what it means and what's included. So I'm just I want to see if anyone else has any comments or questions for Dr. Blair. I don't see anything really coming in right now. Oh, Serafina. Serafina, I am going to allow you to talk. If you don't mind, you can unmute yourself.
I think I'm unmuted now. Thank you for taking my question. So I'm a fellow policy political wonk out in Seattle, Washington, and also a kidney patient. And so I'm really curious, maybe on the advocacy front, like I have very progressive, you know, folks in office in Washington State who care a lot about communities of color. I'm a person of color. So I think I'm just curious maybe where there's energy with senators or representatives on the advocacy front, and how someone like me on the West Coast who's maybe not in DC could participate, or yeah, I'm just curious what the advocacy looks like and kind of getting those sponsors and getting folks energized.
Serafina, you said you're from Seattle, correct?
Yes.
Have you registered for Hill Day yet?
I have.
Okay, which is great because you're from Washington and your senator is Patty Murray. And Patty Murray is the chair of the Health, Education, Labor, and Pensions Committee, which is the most powerful healthcare committee in the Senate. Her office will be the one who helps us decide whether this bill, when it's introduced in the Senate, gets moved and talked about. So we need folks from our Washington community like yourself to register and go beat her door down and let her know that we are here. I know that sometimes we think winning battles or winning policy battles is sometimes about convincing Republicans or convincing Democrats, but now for you, it's convincing a very powerful person in the United States Senate to look at what we're doing. So, you know, your advocacy is amazingly important.
Awesome. That's great to hear. I was like, how do I get involved? What does it look like? So that's awesome. Thank you.
Yeah, thanks for speaking up. And I think that for the Hill Day, right, it is virtual, but if there's an opportunity that you could go to the more local office, obviously that Blair could obviously help you in any way, and give you any guidance that you might need for that as well. So thanks so much for speaking up today. Anybody else? You can raise your hand. We'd love to hear from you.
I think it's incredibly important that some folks don't get while we're waiting on anybody that want to be brave and hop in. I think sometimes, just in my experience of doing this, folks think that, oh, I live in a super blue state, or I live in a super red state, and a Republican is never going to, throw more money towards healthcare research, or a Republican's not going to care about communities of color, or vice versa. But I have found that, and this sadly becomes less true day by day, but generally I think the sense is that healthcare, and especially, social determinants of health is a good way to phrase it, that brings in a Republican audience. Looking at what the social determinants of health are, and the social determinants of rare kidney disease, framing it that way is an incredibly easy way for us to attract folks from the side of the tracks that we may not think would be receptive to our message. So everybody's voice is important, no matter where you are.
Absolutely. Absolutely. Well, it doesn't look like we have any other questions or comments right now. Dr. Blair, do you have any final words or comments that you'd like to share?
No, I know I dropped a lot on everybody once again. It seems like when I come around, I drop a lot. Take the time to digest it. My information is available. I hope to see everybody at Rare Kidney Disease Week. Please sign up. And if not, everybody have a wonderful day. And, it's a great time to be in this community. And I think we've got a lot of energy behind us.
That's great. Shannon says, appreciate you both. Love the passion, Dr. Blair. We do.
You all make it incredibly easy to be passionate about this.
Golly, we do love your passion, and we love what you are bringing to our community, because this is a different level of advocacy than we have ever participated or been involved with. And to have someone with your experience and knowledge behind this to really help and guide us is truly something we are blessed with. So we appreciate you. We appreciate you. And so we want to thank you for being here today. Whether you're here live or you're watching this recording later on, know that you can always find us at NephCure.org on our website. There is right now a banner. When you go to www.nephcure.org, there's a banner on Rare Kidney Disease Week. So I encourage you to click on that, find some more information, register if you haven't gotten a chance to yet. There's also an opportunity for you to register for our NephCure Advocacy Network on our website as well. So look for that opportunity. And you can always reach Dr. Blair or myself. Dr. Blair's email again is zkiser. It's ZKISER at nephcure.org. I'm Kristen Hood. You can reach me at khood@nephcure.org. We'd love to hear from you. Thanks so much for being here today. Dr. Blair, thanks again. I love working with you. Thanks for this wonderful presentation for our community.
Bye, everybody. Have a great day.
Bye-bye.